Hi, I'm Esther.
G'day, I'm Phil.
So today we're going to talk about shin pain or shin splints. So Phil, what is shin splints?
Well, Esther, it's there's lots of things that can cause pain in the shin.
Yep.
So often that would be the diagnosis. If you saw your doctor, they would say, "Oh, you have shin splints." But there's actually a whole bunch of things that could be put into that category. There are problems with muscles and problems with bones. They're probably the two main ones. And there's also problems with blood supply and other things like that. But the number one reason that people will get pain or shin splints in that area is a condition called Medial Tibial Stress Syndrome, which is a bone-related one.
Okay. So what are the symptoms of medial tibial stress syndrome?
Well, they're a bit different for everyone, but the most common presentation is usually an athlete, so someone who's doing some running or some sorts of sports, and they'll find that the pain will come on when they do more training. So they might be running, 5 or 10 Ks a few times a week, and they'll find after a certain number of kilometers, the pain builds and gets really quite painful, even to the point that they have to stop often. So they have to stop running and then it might settle, or it might even take, in some cases, a couple of days to settle down again. Yeah, so that's normally how people will present with it when they've got it.
Okay, cool. And I guess which age group does it usually affect, and which gender as well?
Yeah, well, it's common in quite a few ages. Probably the most common would be, I would think, teenagers and people in their 20s and 30s. It's probably the most common, and definitely much more common in women than men, because women have slightly skinnier bones. So the bone we're talking about is the shin bone, so that's the tibia. So that's it's a bit skinnier in women than in men, so that makes them a bit more susceptible to it.
Okay, cool. And another question, Phil. So would you mind going through the mechanical causes of it, of how it's brought about by biomechanics and things like that?
Yeah, so this is the really interesting side of it. So we can go really in depth of what causes it if we need to, but probably the most simple way to explain it is bones like to be loaded in a certain way. So this bone particularly, the tibia, it likes to have load applied in a straight line. If that's not happening, and it's usually due to the way the foot and ankle and leg are working, if that bone is in a bit of a different position, it increases the bending in that bone. So it means that you're getting a little micro stress and micro fractures in the bone. And that's why those bones start to get swollen and sore.
Okay, and we'll have an image here.
Yeah.
So would you care to explain what's going on in these stages of medial tibial stress syndrome?
Yeah, so what you've got is healthy bone here, where there's no problems at all, and it goes through a progressive grading system where there's more and more stress. So if you've got no pain here, in this stage where you're just getting some edema in the periosteum, which is the outside layer of the bone, it may appear as a bit of an ache, but as it progresses through, this is where it starts turning into not just a stress reaction in the bone, but actually heading towards a stress fracture where the bone will actually crack. Now, it may not move out of place, but there'll be a crack in that area. And that's where people are really feeling symptoms. And that's where we need to really watch out for that, because a stress fracture can turn into a proper fracture. And that's not fun at all. We don't want that.
Yeah, so how can we treat it, Phil? Like, what's the preventative measure as well that we can look at?
Well, the first thing is assessing well and working out that it is this problem, because if it's just a muscle strain or a bruise or just a tendon issue, that's quite different. Whereas if it's a proper stress reaction in the bone, we need to treat it quite seriously. The biggest thing is addressing the biomechanics of how that person is running and moving. If something's not working right, that's where you're going to get injury. So just like if your car's wheel alignment is poor, you'll feel the rattles and your tires will wear out. Our bodies are quite similar. If they're not working the way they should, there's going to be problems, and we are experts, Esther and the rest of our team. That's what we do. So there's definitely assessing it and making sure that is the condition, addressing the biomechanics, usually using orthotic therapy. That's one of our favorite ways. So we'll actually get something in your shoe to straighten things up and make it work a lot better. But then there's also consideration on monitoring or changing the loading. So we've got people who are pushing to do, you know, marathons or doing long distance events, or they're just playing, you know, 2 or 3 sports. That's quite common in younger kids as well these days.
Yeah.
So we'll look at that and we'll help give you advice on where to reduce some of your loading, because sometimes to speed up you've got to slow down. You know, you want to get to a goal, slow things down, heal up, and then rebuild in a way so that you're not going to get this injury again. The good news with this problem is its recovery rate's really quite good. There's many people I can think of that myself and the rest of the team have looked after that not only have gotten out of trouble but got back to the level of training and even more with the right treatment approach. So it's definitely something we can help with and solve for most people.
Great. No, that's really educational, Phil. Thanks for that.
Thanks, Esther.
So, Phil, what would you tell patients out there or people who are listening what they should be doing if they have shin pain?
Yeah, well, regardless of who's already helping you, and often people will have their GP or the physio, we love working in a team with those kind of professionals because we add our part, and often that can be the game changer for shin splints, is getting a podiatrist involved to get an assessment of how the foot and ankle is working, because it's not the shin that's the problem usually, it's usually the way the foot and ankle is working underneath it. So the best thing to do is come and see us. So that would mean calling us, like just call our clinic and have a chat to our friendly front desk team. Or you can jump on our website. We've got so much information on there, and we've got some good information on shin pain as well. So you can have a read, and you can book online. So if you're watching this after hours, you can just jump on and book in, and we'd love to help. So I'm thinking runners, I'm thinking adolescent sports, people. And even people, we do see people who just get this pain because they're on their feet a lot, whether that's at work, walking around a mine site, on a job site. If you're getting sore shins, that's hard to say.
A bit of a tongue twister.
Come and see us because it's something we love to help with.
Yes. All right, so I think that's it from us today. It's very informational, helpful.
I think so. If you've got shin pain, it's very helpful.
Yes. All right, that's it from us, guys.
Thank you. Bye.